In this video, I'm going to look at calcific Achilles tendonitis or tendinopathy. We're going to look at what causes calcifications to form in your Achilles tendon, then what factors predisposes you to it. We're going to look at what this means for your healing process. So how does it affect your healing? And lastly, we'll take a look at how do you treat Achilles tendonitis when you also have calcifications associated with it. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your injuries. Have a look at the description of this video if you want a link to our website. So what is calcific Achilles tendonitis or tendinopathy? So that is when you have calcium deposits that form inside the tendon, as well as the normal structural changes that you see in the tendon when you have a tendonitis or tendinopathy. Now, the most common place for the Achilles tendon to get calcium deposits is where the tendon inserts into the heel bone, so at the insertional Achilles tendon. Sometimes the calcium deposits can attach to the bone and you get little bony spurs there, but it's not the same as a Haglund's deformity. Haglund's deformity is when the heel bone is shaped in a certain way that there's a pointy bit. A calcium deposit is something that forms separate from that in the tendon, and it can also dissolve on its own as well. Whereas a Haglund deformity does not dissolve, it's part of the bone shape. Why do we get calcifications in our tendons in the first place? What causes it to happen? The researchers aren't really sure yet. The main theory is that you injure your tendon and then something interferes with the natural healing process, and that causes the body to form calcifications. But they're not quite sure what can interfere with the healing process. So there are a few things that's kind of standing out at the moment. The first is that the research is definitely showing that people with metabolic disorders like diabetes, underactive thyroid, very high cholesterol, those conditions seem to predispose them to getting calcifications in their tendons. And it makes sense to an extent because we know that these conditions also heavily interferes with the body's ability to heal itself and produce new cells. Diabetes, for example, can cause wounds to just not heal at all. So that's one reason or one category that can interfere with the healing process. There's also some evidence that medication may play a role. There's research in rats that show that if you take statins, that causes injuries or calcification in the Achilles tendon. But this research has not been done in humans, so we always have to be careful when we look at animal studies because they may not apply directly to humans. But there's a third category of person who gets calcifications in their tendons. And it's healthy young athletes who don't have any chronic conditions. They're not on any medications, but they end up with really painful tendons with calcifications in them. Now, in their case, it may be that actually it's their training and the exercise they're doing that's interfering with the healing process. So before the tendon can start to heal itself, they do a training session that's too hard or too intense or too frequently, and that's stopping it from healing. And that may be the reason why they get calcifications in their tendons. So in summary, we're not 100% sure, but it's likely something that interferes with a natural healing process, and that thing that interferes may be different for different people. What does having a calcification in your tendon mean for your rehab? How does it affect it? Now, the research is a bit lacking in this area, so we've got to go on our clinical expertise and what we observe with our patients. And what we see in practice is that usually people who have calcifications associated with Achilles tendonitis seem to have much higher pain levels. So it causes those tendons to be a lot more sensitive and painful. They also tend to be very irritable. So it's very easy to flare them up quite quickly. So you have to take the rehab quite slowly and increase it in tiny little bits. Otherwise the tendons flare up. And lastly, it also helps, they often don't cope with stretch as well as a tendon that don't have calcifications in them. So you have to start the rehab exercises and positions that don't stretch the tendon. So for instance, doing them to floor level, but even perhaps I've had to put heel raises or heel lifts in my patient's shoes in the past to not even go all the way down to the floor at the beginning, to just start strengthening the tendon in that range where it doesn't go into stretch. So there are a few things. It basically just makes your rehab go a bit slower. There is some research to suggest that also you may be at a higher risk of rupturing your tendon when you have calcifications in it. So that's just another reason why it's really important not to rush back into sport, that you take your time and really strengthen the tendon properly. Make sure you do a proper strength training plan, you get the plyometric strength in there, and you do it for long enough, and only then ease back into your running or whatever sport you want to be doing. How do you treat calcific Achilles tendonitis or tendinopathy? Now, one of the main concerns our patients often have is that will they require surgery if they have calcifications in their Achilles tendon? The good news is very likely not. So a small percentage of patients may require it if they don't react to treatment, but the vast majority gets better without any issue, even though they have the calcifications there. There's an interesting research study where researchers, and by the way, all the research studies, the links can be found in the description of this video if you want to read them for yourself. What these researchers did was they looked at all patients who came in for different foot and ankle complaints into the hospital for a set period of time. And they scanned their Achilles tendons. And they found that 101 of them actually had calcifications in their Achilles tendons. But what they also found was that only 3% of them had symptoms associated with it. The others had no pain or discomfort from it, and it didn't interfere with their lives at all. So what that shows us is it is possible to have calcifications in your Achilles tendon without that actually causing symptoms. And this is what we see in our patients as well. The treatment for Achilles tendonitis associated with or calcific Achilles tendonitis is exactly the same as you would do for regular tendonitis. The only difference is that you may have to go a bit slower with the rehab and not increase it as quickly, because remember, these tendons are usually more sensitive, and you want to avoid those stretch positions when you do the rehab at the beginning. You want to eventually work into it because the tendon has to be able to accept the stretch and the load under stretch eventually, but that's for later in the rehab process. So your physio will help you figure out what is the best way to do the exercises and adapt them for your tendon and the sensitivity your tendon is showing, that you get the most out of it and it doesn't flare it up. The other thing that's important is to ensure that if you do have an underlying condition like diabetes or underactive thyroid that can interfere with your healing process, you have to have it treated, and you have to make sure that your treatment is effective. So for diabetes, blood sugar levels, monitoring those, making sure that it stays within the normal ranges. For thyroid, making sure that you get your checkups, check your blood levels with that, take your medication, make sure that you're on the right dose of that. So yes, in essence, treatment is exactly the same as for tendonitis. Your rehab will just have to be adapted according to the sensitivity and may go a bit slower, and you will likely not require surgery. It is possible to recover from a calcific tendonitis without the calcium deposit being taken out. Let me know if you've got any questions, and remember, if you need help with any Achilles injuries, you're welcome to consult our team via video call. The link to the website is in the description of this video. Take care.